When your body is battling cancer, recovering from a major surgery, or growing a new life, the last thing you want to deal with are those terrible side effects. Thanks to Ondansetron, you can spend less time tossing your cookies and more time with your family baking them.
2 years ago, I was diagnosed with stage 2 ovarian cancer. After discussing treatment options with my doctor, we decided chemotherapy and radiation would be best for me. I won't lie, at the start things weren't easy. The treatments made me incredibly nauseous. I was worn out from throwing up all the time, and I started to lose weight. After my doctor added Ondansetron to my treatment plan, things got a little better. I wasn't quite so worn out anymore. That nauseous feeling finally went away, and I stopped losing weight. Thanks to Ondansetron, chemotherapy sucked a little less, and I've been cancer-free now for a year.
When using Ondansetron in patients receiving chemotherapy, be sure to check for drug interactions before administration. Use caution in patients with hepatic impairment, as this may alter the excretion of this drug and lead to toxicity. Concurrent use of this drug with dexamethasone may improve the effectiveness of Ondansetron in controlling cisplatin-induced nausea and vomiting.
If not for Ondansetron, I'm not sure I would have been able to withstand the drain and nausea the chemotherapy put on me.
In the beginning of my pregnancy, I struggled a lot with nausea and vomiting. I found myself hovered over the toilet day in and day out. I could never eat anything that I wanted, or even that I didn't want. No matter what I ate, it just came right back up. I didn't think this was normal, so at my 16-week appointment, I decided to discuss my concerns with my doctor. He told me this was a condition known as hyperemesis gravidarum, and that it happens a lot in some pregnancies, but there were treatment options available. He prescribed me Ondansetron. Ondansetron really helped me enjoy the last 2 trimesters of my pregnancy. Without Ondansetron, I wouldn't have been able to eat the things that I craved. With Ondansetron, I was really able to bond with my baby and really enjoy my pregnancy, which I was afraid of that would never happen.
Ondansetron is a pregnancy Category B drug and should be used in caution in the first trimester due to risk of development of fetal cleft palate. Caution should be used in women who are breastfeeding. Information is limited on the effects of this drug in patients under the age of 1 month. Always consult your doctor before starting any medication when you are pregnant or breastfeeding.
Thankfully, Ondansetron allowed me to enjoy my baby in utero and out.
I've been working at a surgical center for over 10 years. One of our most common complaints from our patients, aside from pain, is nausea. Recently, our doctor started adding Ondansetron to our patients' treatment plan, and since doing this, our patients have complained less about being nauseous and are able to go home faster. And well, that's great for everybody. Since adding Ondansetron to our patients' treatment plans, I am seeing much happier patients post-surgery.
Ondansetron is a serotonin-blocking antiemetic drug and prototypical for its class. Ondansetron works by blocking the 5-HT3 receptors in the GI tract, the chemoreceptor trigger zone, and the vomiting center of the brain. This drug is available for both oral and IV use, as well as in transdermal patches marketed as granisetron. Those taking Ondansetron should avoid driving or operating heavy machinery, as it may cause drowsiness. While taking this drug, be sure to change positions slowly to avoid the side effect of orthostatic hypotension. Avoid taking Ondansetron with alcohol or other CNS depressants, as this may cause serious CNS depression or may lead to toxicity. Those taking an SSRI with ondansetron need to be monitored closely for serotonin syndrome. The most common side effects reported were diarrhea, fever, and headache. If at any time you experience chest pain, difficulty breathing, extreme lethargy, or dizziness upon standing, stop taking ondansetron immediately and contact your provider. Ondansetron is covered by most major insurance providers.
Thanks, ondansetron.
Thanks, ondansetron.
Thanks, ondansetron.